All right, so we're going to be joining input. We want to be appreciative of your time and also respectful of your schedules. So, with that being said, I want to give a brief introduction and then we'll start with the webinar. Thank you, everyone, for joining this space. We're very excited to have our collaborator, Michael Banyas from the NIH, to provide some very interesting points about a new opportunity with the agency. We want to give a brief introduction about our programs and how at the Trust we support projects, entrepreneurs, and researchers such as yourself. My name is Jan Ortiz. I am the SBIR program manager for Acceso Grants, and I work alongside Bridget Padilla, Dr. Juan Figueroa, Valentina Pirazzi, and our executive director, Denise Rodriguez, leading this program, which is focused on supporting entrepreneurs and researchers access SBIR and STTR opportunities. Before I dive into it, I'm going to speak a bit about the Puerto Rico Science, Technology, and Research Trust. The Trust is a nonprofit organization that was created by law in 2004 with the focus on investing and developing Puerto Rico's economy, focusing on four important pillars, which are research and development, entrepreneurship, public health, and education programs. Our mission is that Puerto Rico is recognized as a global innovation hub, and that's why we drive different initiatives focused on these four pillars. We have various programs across these different areas, and I want to highlight some that are in the R&D as well as the entrepreneurship sector. So we have the Research Grants Program focusing on developing mechanisms to fund research projects, which many of you I know are already participating in. We also have our Technology Transfer Office helping with patenting and doing tech transfer from the academia or universities to businesses. We also have our Research Institute that pushes a lot of important research in the island and collaborates widely with academia as well. And on the entrepreneurship side, I want to highlight Comunidades 66, our program that we lead, focusing on ecosystem building and bridging gaps in our ecosystem in Puerto Rico. Our sister programs, Fase Uno, which is an incubator, Parallel 18, which is our startup accelerator with other various sub-programs, including Pre-18, a pre-accelerator, P18, the global accelerator, Expand, focusing on large growth companies, and BioLeap, a life sciences incubator. Additionally, in the program that we'll be talking about, Second Grant, focuses on the SBIR and the STTR programs. Additionally, we have other efforts focused on public health as well as education, many of these also focusing on pushing research and economic development forward. A bit about Comunidades 66. As I mentioned, this is our ecosystem building program focusing on bridging gaps in Puerto Rico's entrepreneurship ecosystem. We are obviously part of the Puerto Rico Science, Technology, and Research Trust, but we are also part of SourceLink, which is a national network of ecosystem builders that are focusing on developing their communities in different states across the entire United States. Additionally, we focus on connecting entrepreneurs with the right resource at the right time. And this is part of why in our ethos, we have built and developed the Acceso Grant program to focus on bridging the gap for innovators to be able to take their technologies from lab to market, leveraging the SBIR and the STTR programs. We leverage a huge network of over 200 organizations and programs in Puerto Rico that include academia, government, nonprofit organizations, as well as capital allocators, among others. And we work alongside our other programs within the Puerto Rico Science Trust's innovation and entrepreneurship pillars. A bit about Acceso Grant. This slide captures everything that we offer. We are currently funded by SBA through the FAST partnership, which is the Federal and State Technology Partnership. Our funding is focused on providing technical assistance to entrepreneurs and researchers that are interested in the SBIR and the STTR programs. And so we offer a variety of services and support, including education and accompaniment. We have a boot camp coming up for our program participants. We also offer technical assistance, connecting entrepreneurs and researchers with grant writing advisors that have experience with the SBIR STTR programs to help them navigate through this complex process. We also have a huge network of mentors and other partners that we leverage to address very specific issues that companies may face in this process. And we collaborate with other organizations to provide support. For example, the Grupo Guayacán in Puerto Rico, which leads the ICOR Puerto Rico program as well for customer validation. And not just this, we also provide additional funding to entrepreneurs and researchers. So those that are successful acquiring SBIR and CTR grants, the trust is prepared to provide matching funds of $200,000 for a phase 1 award and up to $200,000 for a phase 2 award. Behind this infrastructure and behind all of this work is this wonderful team that I am very privileged to work alongside. I'm highlighting here the Comunidades 66 team, but as I mentioned in the beginning, I work very closely with Frida Padilla leading the Secretary Grant Program, and also with Valeria Alicea and Noriana Melendez, who help us in our different outreach as well as marketing initiatives. And lastly, but not least, also our advisors, who we work very closely with, Valentina Pirazzi, who is our project manager and advisor, and Dr. Juan Figueroa, who is a former NSF program director, as well as our SBIR CTR advisor. But this work, we cannot do it alone, so we also highlight these other important partners in our ecosystem that are supporting different initiatives within this effort, and with which we are collaborating to help entrepreneurs and researchers such as yourselves access these different opportunities. Now, before I give it over to Michael, I just want to mention this last thing, which I think is very important, and the reason why we are collaborating and organizing these types of webinars and conversations. And it is that Puerto Rico is massively underrepresented in the SBIR CTR programs across the United States. We are the third lowest jurisdiction with SBIR awards. And since the program's inception in 1987, the island only has won 56 awards, which is very low compared to our next the state over, which is Alaska, with over 100 awards won. And so we really want to push for these types of initiatives and opportunities for more companies and more researchers to be able to access them and build successful businesses from Puerto Rico. Since the trust has entered into the space, that number of awards proposals submitted throughout the years have been increasing, but we need to identify more people like yourselves that are interested in these opportunities. So with that being said, we thank you very much for your time today, and I'm very, very pleased to present our speaker, which is Michael Bañas. He is part of the health and community health within the National Institutes of Health, and specifically the National Institutes of Minority Health Disparities. He will be talking to us about a new opportunity focused on SBIR and focused on innovations for minority health. So with that being said, Michael, over to you. Michael, I think you're on mute.
Hold on, let me, I know this is the shared, hold on. Okay, I know you're looking at my shared screen. Sorry. So while I bring up my presentation, so I'm Commander Michael Bañas. I'm the program manager for the National Institute of Minority Health and Health Disparities. And during this presentation, I'm going to focus on several things. One, is this still in presenter mode?
Yes.
All right, hold on, let me toggle it. Display settings. Okay. So I'm going to talk about a few things. First, an overview of the program. Two, this opportunity, this funding opportunity that's open and that closes in June 11th. And three, opportunities and for both Puerto Rico and in women's health that align with this funding opportunity, as well as just some tips on how to submit abstracts so that you can speak to my other colleagues if you have a concept that overlaps into another institute. So first, for those of you who aren't familiar with the NIH SBIR program, the SBIR program stands for Small Business Innovation and Research, and the STTR program stands for Small Business Technology and Transfer. That is the program where you're going to need an academic partner. With the small business, I'm only going to focus on the SBIR program. Both programs are also known as America's Seed Fund, or a key part of the NIH's mission to accelerate discoveries from bench to bedside, but also take discoveries and not only just get them into bedside, but also put them into different markets. different customer markets, different environments, different areas for which there's health access issues. These programs set aside $1.4 billion in non-dilutive funding every year to specifically to support early stage small business research and development. One of the other things is that we are still updating our communications during the transition to the new administration. So all the information about how to register, how to apply and register for your federal, DUNS numbers and funding opportunities and other resources, those can be found at www.seed.nih.gov. So the SBIR program is a congressional program in which funds are set aside from the NIH budget. And I'll go into the breakdown of that, of how funds are broken down by institute in a few slides. But these are to help small businesses, stimulate technological innovation, provide economic and job support, use small businesses to meet federal R&D needs, and also increase interactions with the private sector on how to get their innovations for increased competition, productivity, and economic growth. This is perfect for Puerto Rico because of the economic and job support, but also there's a lot of innovation and small businesses taking place on the island that are ripe to take advantage of these funding opportunities. So the NIH has 27 institutes and centers. Most of them have SBIR programs, with the exception of the Office of the Director and Office of Scientific Review. The bigger the institute, the bigger the SBIR program, but also don't underlook the smaller institutes, and I'll go into why in a little while. So institutes range from National Cancer Institute, National Institute of Aging, Heart, Lung, and Blood, Neurology. All this information can be found on the NIH website, but pretty much the way that they're broken down into is into disease-specific areas or areas of scientific need. So the funding opportunity we're going to be talking about, and it's due on June 10th. And I'm sorry I didn't, that I'm presenting this with less than 30 days to actually apply to this funding opportunity, but there's a number of partnering institutes that are a part of this. And I'm going to go more in depth into the funding opportunity in a bit. But those include the National Institute of Neurology, Disease, and Stroke, the Heart, Lung, and Blood Institute, Institute on Aging, the Dental Institute, the Diabetes and Digestive and Kidney Disease Institute, and the Nursing Institute, among those. So one of the things that's great is that we're all very collegial here at the NIH SBIR program. So if you have overlapping concepts that might focus on heart, lung, and blood, as well as aging, we all work very well together, because our primary concern is making sure that our primary goal is to make sure that you get the help necessary to put forth a successful application. So as I mentioned, there's $1.4 billion spread across the NIH, in which comes from a set aside from our extramural funds for each institute. So each institute, extramural funds is money that goes out the door in the form of research grants. So if you have the larger the institute with the extramural funds, such as cancer, neurology, the larger the SBIR budget you're going to have. But just because they have larger budgets, don't ignore applying to the smaller institutes, such as my institute, such as Minority Health and Health Disparities, the Nursing Institute, NIAAA, the Alcohol Institute, because we all fund things very differently. Some of the bigger institutes really rely on a pay line, which means that if you don't get a certain score, and I'll talk about how each application is evaluated in a few slides, but if you don't get a 20, if NCI's got like a 26 pay line, you're probably not going to get funded unless your score is below a 26. With some of the smaller institutes, we're more versatile into picking and choosing on which scientific applications can best fit carrying out our mission, regardless of score. But that's also why interacting with your program officer is or your program manager for each of these programs is extremely important for clarity and also fit. So why seek NIH and SBIR funding? So the first is it's non-dilutive. So that these are grants, they're not loans. We don't take any equity. You keep the intellectual property, and the small business retains ownership and control. The second is these programs are a significant source of funding for early stage companies. For example, you can apply for, it's not just you can apply for one phase one and then you go to phase two. You can apply for multiple phase ones. You can really use these grants to scale up and also further develop your technology and your business to help meet the needs of various customer markets. There's also rigorous peer review, unlike VCs or investment companies. We're only looking at scientific validity, not at what is going to be the most profitable. So, and I will talk in a little while about how each application is reviewed. There's also the prestige and attractiveness of saying you're an NIH funded company, or if you're trying to recruit outside partners or investment and saying, hey, this is like where we got our NIH score. These are some of the holes that we're working to fill, but we got this score and we got discussed, which helps give not only prestige, but it also gives validity to your concept. There's also a lot of commercialization focus and access to federal R&D resources, such as entrepreneurs in residence, if you're an awarded grantee, access to the I-Corps program, and various other resources that you can go into with your individual program director if you speak with them. Eligibility criteria, and once again, this can all be found on the seed.nih.gov website. So per the Small Business Administration guidelines, in order to be eligible for SBIR, you must be organized as a for-profit U.S. business. Must be smaller than 500 employees, including your affiliates. Work must be done in the U.S. So if you have a foreign software engineer, that every bit of money that is being used to develop your business from this grant, everything must be used in either the United States or in one of the territories. Individual ownership, 50% must be U.S. owned by individuals and independently operated. And I apologize if a lot of this presentation pretty much focuses on states. It also applies to the territories. It must be greater than 50% owned by other businesses or concerns. So no more than 50% owned by a venture capital. The other thing too is this is one of the few NIH grants anyone can apply to. You don't need to be a doctorate. You don't need to have a doctorate. You don't need to be on the academic research track like most NIH grants are. Like, we are open to a variety of disciplines such as allied health, computer engineers, biotechnology engineers, health managers. Like, I know University of Puerto Rico has a great health administration program, and you don't even need a degree to apply. This is really a versatile grant program that's open to, just funding the best science to support the NIH's mission and support its research. So just a little bit about the phases. And once again, this can be found on seed.nih.gov. So there's two phases. So the first is phase one, which is $314,000, unless you qualify for a budget waiver, which is dependent by each institute, and that can be found online. And that's for a 1 to 2 year project. Look at these as projects. Don't look at them as your business is your business can be a project, but sometimes your business is bigger than your business. What you're trying to do in your business encompasses multiple projects. So look at the phase one as a project. That is just proof of concept. You're looking at usability. You're looking to see if the customer is actually going to buy this. You're looking to see if it's actually going to work in this setting. For example, if you're doing clinical research, like a clinical research support tool, will the research person, the research coordinator actually use it? Is it actually adaptable to a variety of research sites? They're also great for going into different markets. So if you have an urban market and you want to go into you want to pursue a rural customer base, phase ones are great for taking that that concept and applying it into a different customer market. So you can take that $314,000 and, you know, adapt your business to this different customer market. And, you know, that is a way of helping create health access. Phase two is a larger research question. Phase one, I should have said, is a smaller research question. Phase two, you're going for commercialization. You're going to prepare for an IRB. You're going to prepare how to launch in maybe multiple customer markets. That award is $2 million plus. It's usually a 1 to 3 year project. And that is meant to, you know, where we expect you to start selling a project, your product within that period of time. Now you can, if you've already done phase one and you've got your proof of concept data, you can apply for a direct phase two. There is also the fast track award, which is phase one and phase two combined. If you're applying to direct phase two or fast track, please contact the program manager for that institute. We all have different philosophies and different outlooks for how the institute funds these. So it's really beneficial to get that feedback. I know there's been some times where I've gotten someone wanted to do a direct phase two, and I'm like, well, why don't you just break this up into multiple phase ones, because you're still doing usability testing. You're not ready for commercialization. And, you know, you could apply for multiple phase ones at once, or apply for your direct phase two, but also apply for a phase one for where you want to be 9 months from now. Oftentimes when I have conversations with applicants, it's about what you want to use the NIH money for 9 to 12 months from now, not what you want to do, not what you need right now. A lot of my conversations are about business development, which includes staffing, pursuing customer markets, you know, how you're going to actually pursue your research and develop the product. That is the conversation we are likely going to frame around in pursuing a phase one and phase two. So the review process. So this also applies not only to this funding opportunity, but also the omnibus, which is open 3 times a year, which is early January, April, and September. So if you miss Healthy Innovations on June 11th, you can also apply for the September omnibus, which all the institutes apply for, which all the institutes are a part of. So each application has 3 assigned reviewers. In reviewing the application, they only score 50% of the applicants. You will get comments back regardless. So I got someone called me yesterday and they said, well, I got a 54 on my application. It was the first time I applied. I was like, oh, that's great. You got scored. Getting scored, especially on a first time submission, is big, because then you have really targeted feedback on how to reapply and what holes there are in your concept. So the review criteria, the lower the score, the better. And they're scored on each section criteria is scored on a level of 1 to 9. So I'm going to talk about the area where a lot of people lose credibility with the reviewers first, and that is the investigators and the investigator team. So if you do not have the right team, or in your bio sketches, you do not convey how you have the competencies to carry out the project, the review team is going to lose confidence that you are going to be able to use this federal investment appropriately and that you are ready. So it's very important that when you write your bio sketches, for example, if you're doing something in diet, you know, if you're doing something that requires an evaluation, that you have someone that has evaluation experience. If you're doing something in clinical research, you have experience with like an institutional review board or actually working at a site. That's going to be extremely important in providing confidence to the reviewers right off the bat that you can carry out the project. The other thing is be very clear in the significance and why this is a problem. In addition, your innovation. I also see a lot of scores where the reviewers are like, well, this is already being done. Be very explicit in saying this is the current market, or the current way of providing care to this population, or even just delivering the service, and why what you're doing is going to be either more efficient, lower cost, lower costs, or provide more access to that customer market. The other thing that's very important is the approach and the environment. The approach is what's your research design? How are you going to implement? How are you going to attack the problem with the investigators' skill sets? And also, it's important to make sure the approach and the environment go hand in hand. For example, if you're going to be creating a product for rural Puerto Rico, you're not going to test the environment in San Juan, which is an urban area. You want to make sure that if you're focusing on a rural population, you are testing this in a rural population. If you're testing this in an aging population, you want to make sure that it fits that criteria. And you're not just testing it in a place that is mostly like middle-aged adults. So just a little bit about National Institute of Minority Health and Health Disparities. We are disease agnostic, so we take everything. We're not really focused on drugs, but we do consider them. We're more focused on devices, services, digital health, and other means to close health access gaps. It's all about providing care to people that aren't getting it where there's a disparity. And that's why we promote research to understand and improve the health of populations, advance scientific understanding on the causes of health disparities. We want those interventions that are funded by SBIR to help provide health access and reduce disparities, but also support our research, such as metrics, measures, tools that can help us further identify where gaps exist in providing health access to populations. So just the buckets that are identified as barriers to health access at the individual, family, and community and population level, and all this can be found on the NIMHD website, is we're looking at, for this application, and even applying to our institute, how are you alleviating physical barriers, such as access to healthcare, transportation access? How are you helping increase people's ability to actually access healthcare? The other aspect is health knowledge. And this is actually an area that I think is a perfect opportunity for Puerto Rico. Is health knowledge is about overcoming health literacy, language barriers that are inhibiting healthcare delivery, understanding of how to actually receive care or make care decisions, patient information, how providers interact with patients. I am not going to lie to you. On the US mainland, I have not really seen great bilingual Spanish-speaking concepts. And I think this is a huge opportunity for Puerto Rico to develop Spanish-speaking concepts, especially in a place, in a territory that understands the various areas of the US healthcare system, but also has a lot of disparities on its own it's trying to combat and export them domestically to the state side. When I came down here and when I came down to Puerto Rico in June, this was the light that went off in my head. Was a lot of your population is bilingual. You understand the Medicare and Medicaid system and its limitations and its possibilities. You understand how to deliver care with limited access, but you know how to do it on a bilingual basis. Like domestically, I think Puerto Rico could be a huge exporter of bilingual clinical services and digital health products. The other access barriers are infrastructure, or how are you going to provide, and I think this is perfect for Puerto Rico too. How are you going to provide services that is on par with elite academic medical centers or maybe really well-resourced health networks? Economic, this is another great area of possibility for Puerto Rico, which is how are you going to provide a service which is going to help provide lower cost solutions or take advantage of public or private insurance. I am very well familiar with your Medicare and Medicaid system in Puerto Rico, and that it's pretty much a capitated system. I think the island is ripe for Medicaid innovation, especially since you have such a strong federally qualified health center network. The other thing is it a community or society barrier? Are the beliefs and practices a barrier towards trying to apply this service within this customer market? For example, I'll get aging apps or aging concepts, and they're great for, maybe, a suburban family in the Northeast, but they don't really apply to a Latino population, maybe living in the Southwest or on Puerto Rico or in Florida. There's just too many cultural barriers there that, this is perfect for phase ones to apply to, on how to alleviate barriers to actually access that market with an existing technology. So these are the NIH designated health disparities populations. And in order to apply to our institute and this application in this funding opportunity, you got to focus on one or more, which include people with disabilities. And by the way, this is updated on the NIMHD website. So I know there's a lot of confusion about health disparities and what might be DEI, but this has all been approved by the new administration. So this is legitimate. People with disabilities is a health disparities population. Sexual minority groups, which is the LGBTQ community. Low socioeconomic status, those on Medicaid, Medicare, those on WIC, public assistance, those below the poverty line. Underserved rural populations, which I think is another big opportunity for Puerto Rico. American Indian or Alaska Native, Asian, Hispanic or Latino. I think, one of the reasons why I brought up Puerto Rico as being a really big opportunity for bilingual products is, I know, like, I'm white Eastern European. I'm white European. That's my heritage. My Italian side has much different. They're much different culturally than my Eastern European side, and the same can be said of Latinos. Cubans are much different than Puerto Ricans. Puerto Ricans speak very different Spanish than Dominicans. Mexicans, there's a lot of regional variation there, and that's why I think Puerto Rico is the perfect place to develop bilingual health products to actually export domestically, because you really do know the different Latino cultures and access issues. The other thing is Middle Eastern and Northern Africans, Native Hawaiians or Pacific Islanders, Blacks or African Americans. Once again, if I can go back to Hawaii, it would be great to test the products that you're developing in Puerto Rico and see how they would actually apply to another island area such as Hawaii. So Innovations for Healthy Living, which is due June 10th, is going to have a focus on technology, service, products, and interest for increasing access. So that includes disease self-management, patient healthcare provider or system communication or care coordination tools, diagnostics and monitoring devices and software, electronic APIs, electronic health record APIs, services that help another patient market, clinical research, strategies, or infrastructure that helps train the workforce for delivering care and clinical research, big data, precision medicine. I know Puerto Rico had a huge All of Us site that was actually successful. And I'll go into a little bit more about why I think that's a huge opportunity for the island, and also social determinants of health like housing and food. So this can all be found within the application. Opportunities for Puerto Rico. So as I said, I came down there with the Secretary of HHS's staff in the last administration last June. I love San Juan, but I only was in San Juan. I was hoping to come back down in the winter and actually drive around the island to go to Ponce and go to the other parts of the island as well. So opportunities for Puerto Rico. And I just realized I spelled opportunities wrong. So you guys have a versatile workforce, such as health administrators, such as at the University of Puerto Rico, clinical research coordinators, community workers. You don't need to, like I said, in order to apply to this program, you don't need to have like a doctorate. You do not need to have a PhD. This is open to a lot of different disciplines, and I would definitely take advantage of the health administrators that have a business background and know how to stand up service lines and products within healthcare, within different healthcare groups, and actually do business development. I would totally take advantage of the health administrators in helping carry out your idea into practice. As I mentioned, I thought it's a huge opportunity for bilingual health products for exports to the mainland. Clinical research sites for disease and longitudinal studies. I'm very familiar that there has been numerous clinical research studies going on in Puerto Rico, and I think really incubating and strengthening products to help support that research that can also be exported for doing clinical research in other Latino communities is right for Puerto Rico. You also have a huge aging veterans and disabilities community. You have rural, urban, and tropical environments. An example is when I was down there in June, I spent a lot of time talking about dengue fever and got to meet the great Grayson at the Puerto Rico Trust. And that's just a really unique environment that I think is very valuable for doing research and developing products. As I mentioned, I'm very familiar with your Medicare and Medicaid system, and I think it's ripe for innovations on how to actually lower costs and services and deliver them and to help reduce barriers for actually helping people access those services and delivering them. You have 5 medical schools and research centers. It's ripe for opportunity to develop emergency preparedness and response products. You have a great federally qualified health center network. I think you've got something like 50 health centers and primary care delivery. One of the things that would be great for this that we're really looking for is to develop products that actually fit federally qualified health centers and their unique patient-centered medical home capabilities. So that is an opportunity that I think the trust should totally call up the Puerto Rican Primary Care Association, who I visited with in June, and see, how they can get entrepreneurs to develop products for health centers that can once successfully developed, can be exported to the domestic United States, especially in Latino communities. Telemedicine and remote patient monitoring and precision medicine and genomics. I loved that the All of Us research sites, which is one of the NIH's flagship research programs, had an enormous amount of participation. And I was extremely gleeful and realizing that a lot of it was people were participating because they wanted the return of results. They wanted to be able to plan their healthcare, to know if they needed to go to Florida or Texas to go get different services, or if they needed to make appointments ahead of time, or if they needed to talk with their kids or other family members that might be located in the domestic on the continental United States about family planning or aging care types of services in preparation. So I think that there's huge opportunities for Puerto Rico in this area, and I would love to talk to people about how they believe that they can help develop products that can both help the island, but could also be exported to the continental United States as well. So one of the other things I was also working on here at NIH that I'm still hoping is going to see the light of day was I was leading the coordination of developing an SBIR funding opportunity, just like Innovations for Healthy Living, that focused on women's health. So I just want to bring up this slide because there's a huge opportunity in women's health here that I think would be advantageous to Puerto Rico, such as reproductive and maternal care, such as disease and complication management, data and quality improvement, periactive and postmenopause services, pre and post-mortem care. Like I definitely know with your rural environments, like I'm sure pre and postpartum care is a huge disparity issue. Management of chronic diseases that go beyond diabetes, such as cancer, orthopedic and dermatology, cardiovascular diseases, autoimmune diseases, endocrinology, workforce solutions focused on women, such as creating products for federally qualified health centers or Medicaid, emergency preparedness, caregiving, clinical translational approaches, and allied health, focusing on products that adhere to women with disabilities, public health products that affect women, such as infection control for like sexually transmitted diseases, clinical trials, data usage, and also lifestyle and age, such as nutrition, aging, teen girl, products for teens and girls, wellness, social determinants of health, and precision medicine. Like those are all opportunities there for women. And I think particularly combined with the knowledge and understanding of the workforce on the island, I think it's perfect to create products for women in these areas that can then be not only utilized on the island, but also exported as a business for the domestic United States. And that's another thing I just want to highlight that's perfect for phase ones. Say you develop a product in Puerto Rico and you want to export it to, say, the border areas of Texas, where there's huge Latino populations, or Mexican populations, or to Florida, which is really a melting pot of various Latino populations. That is perfect for using the phase ones for taking that product and entering in those different U.S. customer markets. So once again, this is the Innovations for Healthy Living funding opportunity. These are the institutes that are participating. And if anyone is interested in talking with one of the program managers in these institutes, their contact information is found on the RFA, or you can just email me and I will make that connection. Now, one of the things that this is like my last point. One of the things that it's extremely important for having us help you is to send us an abstract. Well, what does that look like? First of all, we react to things best in writing. There's been times where someone's tried to tell me a scientific concept and I'm like, whoa, because like, not only sometimes does it take a little while for us to sink in what you're actually conveying, and we might need to read a sentence or a paragraph 2 or 3 times, but I'm not going to lie to you. I'm a health administrator by training. I do a lot of Googling to see like what the terms mean. And it's easier for me to do that, on one screen while I'm reading the abstract on the other in order to prepare for the conversation. So how do you prepare an abstract? 1, keep it simple. 2, have it less than 350 words, and this does not include the aims. Within the abstract, make a clear and direct case within the first 4 sentences. What is the problem? That is the significance. What is the proposed project intervention? That is the innovation. And what's your scientific question to increase health access to reduce the burden of health disparities? Do not spend your first sentences on why it's a historical problem. I often get abstracts where the first 10 sentences are all about why diabetes is a problem in this community. And I'm like, just get to the point. Remember, phase 1 projects, it's just usability. It's just proof of concept. Very simple project goals. Phase 2 will require a commercialization plan, such as what markets you want to go to and how you're actually going to sell your product in 1 to 3 years. Now, for your aims, we usually like to have 3 aims. Each one should be a standalone. They should be a project milestone on what you want to do to help. What are your 3 overarching goals for actually making the project successful, such as 1, implement it in like a community of, or test this in a community of like 70 people, do the evaluation, that type of thing. So this is my contact information. So please let me know if you have any questions. Please reach out with an abstract and book a one-on-one appointment, or if you want to talk to any of my other colleagues. And now I'd like to open it up for questions.
Michael, we do have some questions in the chat. I'm going to read them out.
Just rules of the road, political questions about the administration, or like things like that. Just I can't answer. I'm just a civil servant. So
yeah, no issue. No, none of those yet. So the first question comes from Alba Marrero. She's asking for applying to different phase 1. Could it be for closely related projects with different aims, or should every project be significantly different?
So if you're going to apply for multiple phase 1s, each one is going to need a different research plan. So I would put a different title. Like if you're developing like an artificial intelligence system for this aspect of the project, or maybe you're doing service delivery or workforce training for this aspect of the project, they can all be little questions that go to the overarching big scientific question for helping increase health access. But they're going to need different research plans, and the research plans are going to have that a different approach in that environment. And also it might even have different team members for how you're going to carry out the project, but it's going to have different scientific questions.
Thank you, Michael. The next question I have is from
I'm getting
Miguel
a
Castro.
call from the Dominican Republic. I think they know that I was making fun of their Spanish. Just kidding.
So the question,
I have one of my NIH colleagues is Dominican, and he's married to another colleague of mine who's Puerto Rican. So it's interesting to hear them make fun of their different Spanish dialects. So
cultural, yeah, that happens.
which is why it goes back to my point of like, it drives me crazy when I get concepts and they're like, we're focusing on all the Latinos, and I'm like, no. Let me tell you about my neighbors. Everyone's different culturally, especially if you're grouped into Latino culture.
Yeah. So the next question here from Miguel is, do you think that facilitator or education type of private company to bridge medical services in the States to our population may work? I think he's asking if, focusing on Puerto Rican populations specifically. Miguel, if you have any clarification, please go ahead and share.
Could you repeat the question? I just couldn't understand.
Yes. Do you think that a facilitator or education type of private company can bridge medical services in the States to our population, if that may work?
Yes, absolutely. Absolutely. And that's perfect for phase one, because you're testing the medical services within that customer population. Like I look at things like that's how I look at things. I'm like, who's going to buy it? I had a conversation yesterday with a bunch of business development specialists, and it all focused on, we get concepts in, or people come to them with business ideas to develop, and they don't know who they're going to buy it. And so yes, you can translate those services to Puerto Rico, and it's perfect because that's just another customer market, and that's what the phase one is perfect for, testing to see if people are actually going to use it.
I have also a follow-up question there. Is a proposal acceptable if the solution is only for Puerto Rico, thinking about our market, or should it be?
No, you can focus on Puerto Rico. You can focus just on Puerto Rico. You guys have unique needs. The only reason I kept on emphasizing that I think, this is a great place to export products to the United States is because I think that you guys have an enormous amount of talent and that understanding that I don't see in a lot of Latino developed products, that I'm like, oh, I wish this could be amended. Someone would take a phase one for this and actually amend it for Texas, or amend it for Venezuelans in Florida. That's the only reason I bring it up. But yes, you can focus solely on Puerto Rico. You are a U.S. territory. You're U.S. citizens. This is domestically. This is domestic territory.
Yeah. Follow-up question there. Does that logic, or does that sort of criteria only apply for the institutes of minority health disparities, or do other institutes share that same criteria? Let's say, for example, NCI, would a solution only for Puerto Ricans apply in that institute as well?
That's the same thing. Yeah, if you apply to NCI and you want to do something solely focused on Puerto Rico, like I know you've got the Cancer Center in San Juan. Yeah. And if you have questions about that, you can here's the thing that I know drives that in June when I was down there was, and it kind of drives me crazy just domestically, is people, forget, or they don't have the comprehension. You're all U.S. citizens. This is a U.S. territory, pay U.S. taxes. So you can totally develop something for Puerto Rico, just like people develop something just for Texas.
Got it. Okay, perfect. The next question I have here is from Nathaniel Medina. He asks, when applying for different agencies, sometimes they have to specify under which category to review an application, like manufacturing, health devices, women's health, etc. Is there anything you would recommend, depending on the type of service or technology that the company is developing?
Like anything that we're particularly really leaning towards?
Nathaniel, anything you want to clarify, you can open up your mic there as well if you want to
Yeah,
expand on the
hi.
question.
Hi, sir.
My question is regarding when submitting an application that sometimes one is asked to specify under which category should the proposal be reviewed. I'm asking on what should you think is more appropriate when it's a very interdisciplinary project.
Like with the omnibus, how you're allowed to choose like 2 institutes? Is that what you're referring to?
Yeah.
Yeah, with this, okay, so with this funding opportunity, everything is going to come to NIMHD. And the other institutes are basically, if they want to pick up the application and consider it, they'll do that. I send out a list. With the omnibus, you can pick up the 2 institutes, but health disparities issues, we set the policy, the strategic policy direction throughout the NIH. So if you want to focus on health access and just apply to neurology and aging, you could totally do that and use the same arguments. It's all about delivery of care. Like, it's not just about drug development. It's about how to actually deliver services and care. We just fund a lot more services than people are used to, than the other institutes at times.
Thank you.
The next question we had was exactly about that. Michael, it comes from Alexandra Nicole. She says, does it need to be a technology based? And I'm thinking she's referring to like hardware. She says that her project is service based. And I guess my follow-up question or adding to that is, how do you evaluate or how do you review those services? You know, what makes them eligible for the institute?
What makes them eligible? Whether or not they adhere to the concept, the concept criteria, the application criteria. That's why it's important to read the RFA.
They do, but I just wanted to make sure, since I'm not doing like any software or any hardware, that if I comply with everything else. And my follow-up question, if I may, could it be online? Because I know there was a component of infrastructure, but I don't really have like physical business. It's more so online. So I wanted to know.
That's fine. You don't need to have an office. You just need to have an address and be a registered small business.
Okay, thank you.
No worries.
Thank you, Alexandra.
I can accept one more question and then I can answer anything by email. I have to,
Sure.
I scheduled back-to-back webinars. I'm going from Puerto Rico now to New Jersey. So.
All right, so perfect. I just have one last question that I think could be useful for the audience. I know you have the Small Business Applicant Assistance Program. Is
Yeah,
that available
that's not it. That doesn't exist anymore. It was that was a research project. But email me and I can walk you through some more tips. And I'm going to be sending out these slides.
Perfect.
So they
Perfect.
just weren't financially feasible at this point. So.
All right. Well, thank you so much for your time, Michael.
Thank you for the audience. Like, you're my first show of the day. I'm booked solid. So sorry, I kind of got off to a little bit of a slow start.
No worries.
I'll
No
send out
worries.
these slides and I'll make sure opportunities is correct. There's a correct spelling. But in all honesty, like, I'd love to do more stuff with the trust. Like, I truly believe in the territory. And I believe that there's an enormous amount of possibilities there. So.
No, thank you so much for your time, Michael, and we'll keep in contact to continue building out those opportunities.
Thank you
Before
so
we,
much.
thank you.
I have to go.
Before we leave, I do want to share something else with the audience, just some final announcements. With these opportunities that Michael was mentioning, this is just reiterating. You can apply for a Cercata grant. We have rolling basis applications, o mira español, creo que todos hablan español también. Tenemos las solicitudes abiertas durante todo el año que pueden solicitar en confianza. Parte de lo que nosotros hacemos es ayudarles a entender el concepto de innovación que ustedes tienen y si es un buen fit para estos diferentes tópicos dentro de las agencias federales, no solamente con NIH, sino también miramos pues, todas las otras, ¿verdad? Por ejemplo, algunas de las principales, National Science Foundation, USDA, NASA, Departamento de Energía, Departamento de Defensa, etcétera. Así que les exhortamos a que visiten la página web, si escanean este QR code le pueden ir directamente, y luego también lo estaremos compartiendo por email y también por chat para que todos lo puedan recibir. Y finalmente, antes de cerrar, tenemos algunos eventos que estarán próximamente ocurriendo. Queremos hacerle la invitación al Boricua Emprende Fest, que va a ser el 29 de agosto en el Centro de Convenciones. Si escanean este QR code, ahí van a estar recibiendo noticias y anuncios sobre el evento para que puedan también participar. Durante la misma tendremos en la agenda algunos espacios enfocados específicamente en temas de innovación, al igual que de emprendimiento, ¿verdad? Como hacemos durante todos los años, pero también les invitamos a que formen parte del evento. Si escanean este otro QR code, aquí pues tenemos ya unas taquillas que son las Early Bee o ¿verdad? Las que salieron primeras para el evento. Estos tienen un 20% de descuento, así que están, ¿verdad? Mientras duren, pero si les interesa participar de este evento, que es el evento más grande de emprendimiento que hay en la isla, pues les exhortamos a que adquieran su boleto, ¿verdad? Con este descuento y que luego entonces participen. Les agradecemos nuevamente por sacar ese tiempo para estar aquí con nosotros, por sus preguntas para eh, Michael, y estamos ¿verdad? Más que nada a la orden y súper dispuestos para continuar trabajando con todos ustedes que están interesados en este tipo de oportunidades. Así que muchísimas gracias a todos por su tiempo y que tengan excelente día.
Gracias, que tengan buen día.
Gracias, Jan. Gracias a todos. Que tengan todos una bonita
Muchas
tarde.
gracias.
Gracias, muy bueno. Gracias el equipo por darnos la oportunidad.
A ustedes, excelente
Gracias,
día.
Juan.
Gracias, Mil.